And we're live. Good morning, everybody. Happy Friday. We're coming to you from Skin Renew Laser Tattoo Removal. We've not done this before, so if it's weird, it's off, it's live. It's what's going to happen. So we wanted to give you guys behind the scenes of what laser tattoo removal looks like. We are going to be using Brittany, who is our laser technician. This will be her second treatment. We did one about 6 weeks ago. It's on her rib cage. And what I want to just do is kind of hit the highlights of what a consultation looks like, the three main questions that most people have: what's the pain, what's the time frame, and what's the cost. So again, we'll hit a couple highlights and we'll actually do a live treatment. Brittany's second, and she's going to also let you guys know how she felt the first time, what she was thinking when she sat in the chair, and what she thought afterwards. So here we go, and let me know if anybody has any questions or anything while we're live. So at the first time that you come in, we'll do a consultation and we will look at your tattoo. We will measure it, we price by size, and we're going to let you know the pros and cons of what you have with your tattoo. We're going to look at the ink depths. Okay, the laser that we use is a non-ablative laser. It only goes through the first two layers of your skin, your dermis and your epidermis. When you guys think about hair removal lasers, those are ablative. They've got to actually go further into the skin to get to that hair follicle. So we're playing in the two skin levels above that. Black ink sits the deepest. Can you see this okay? Mm-hmm. Black ink sits the deepest, your blues and greens sit next, your purples and reds come up, and then your oranges and your pinks and your yellows and your whites. So as you can see, that's how we're looking. Again, black ink sits down here, your reds are mid-level. In your body makeup, we've got more water molecules, if you will, down in the lower depths of our skin. So when we treat the blacks and the darker colors, we've got more water to absorb that energy level. When we go up towards the top, when you get to these reds and what have you, you've got less water molecules there, so you've got more energy coming in, less water to absorb that energy, sometimes more of a chance of blistering. So that is sometimes a side effect. We try not to blister our patients by any means, but it is a laser that we're using. We try to keep your skin looking as perfect as we can underneath. The next piece of the puzzle is our actual laser, which is right there if you want to pan on over. It's a Q-switch, non-ablative laser like I spoke about. And then come back here if you don't mind, sorry, jobbing you everywhere. We've got three major wavelengths that we use, so we can go on all the color spectrums. The 1064, it's the main wavelength. It goes after all these dark colors. What we're gonna do is we're gonna strip that ink down to its purest form. Now, if you guys go back to art class years ago, black ink is never truly black ink. It always has undertones of blues, greens, sometimes purples. So we're going to strip that ink down to its purest form, and as we start to break up that ink, if we start to see more blues or more greens present, down the road we'll switch to the 694 wavelength, which is called the ruby. This goes after your greens, your blues, and your oxidized blacks. If you've got reds or purples, we use the 532. So again, that laser has all the different wavelengths to go after all the different colors. And then the other piece of the puzzle is what type of needle the tattoo artist used. So this top layer right here, these are what's called liner needles. The second row right here, this is called shader needle. So just like when you guys write, you're heavy-handed in some areas, you're light-handed in others. Same thing with your tattoo artist. So those of you that have the ring fingers, the ring finger tattoos, a lot of times they're these liner needles. And then your tattoo artist was dealing with a smaller space, so a lot of times they were heavier-handed, and that ink got put in there pretty heavily. You can also, if you've got a tattoo, you can feel it. Say it's on your arm. If you feel it raise a little bit, that's because your artist was heavy-handed, and they kind of dug that ink in there. So just things to be aware of when you look at your tattoo. Look at the colors, look at the placement, and look and see or feel how heavy-handed your artist was. I always say that tattoo removal is 50% technology and 50% the body. So on Brittany today, we're going to talk about her tattoo. So she's got one on her rib cage, don't do it yet, but we also have one on her wrist. So when you think about the body's makeup, this laser is going to shatter this ink into smaller particles, and then your body's going to dissolve it through your lymphatic system. Kind of like the game Pac-Man, okay? So your body has these broken ink particles, it dissolves into the lymphatic system. These wrist tattoos, it's farther away from your heart, there's less circulation, we're fighting gravity, so we've got to kind of, what am I trying to say? You got to, that would be a, losing my train of thought here.
It's okay.
When it's an extremity, it's when your heart is, oh my goodness.
It's an extremity, so it's harder for your body to pump that blood when it's farther away from the heart. So it's harder for your body to metabolize that pigment being so far away, so it takes longer amount of time. So the closer it is to her, it actually might go away faster than it being on your wrist, your fingers, your ankles, your feet, all of that good stuff. So actually, the closer it is, the better.
Thank you. I've done this for 5 years and lost my brain of thought. Totally gone. So we also tell people after treatment, in a few days when the area has healed, do some really light massaging or dry brushing and just try to help that lymphatic system grab that broken ink and dissolve it. Tattoos are close to the heart. All this internal circulation is happening, moving and grooving, it's going to grab that ink much faster. So if you're thinking about getting a tattoo, think about your placement. Think about how heavy-handed your artist is. Think about the colors. Greens and blues are notoriously the hardest colors to remove. It doesn't matter what laser you have, it's the ink makeup. So, and again, a lot of times the black ink, it's not truly 100% black. It's gonna have undertones of greens, blues, sometimes purples. So that's that. 50% technology, 50% your body.
Yeah.
So this is Brittany's second treatment. The first time we did this, how did you feel when you sat in this chair for the first time?
I was definitely anxious. Doing it is one thing, but actually getting it done was another. So I was just anxious, definitely scared because I didn't know what it felt like.
Right.
So it's an experience.
Right. So people always wonder, they say, how painful is it? On a scale of 1 to 10, 10 being incredibly painful, most people call it a 5 or 6.
Yeah.
It definitely also depends on where your tattoo's located. So on her rib cage, it's a tender spot.
Yeah.
Right?
Oh yeah.
But it was also tender when you got it put on.
Oh yeah.
Yeah, and then, everybody's got a different level of pain tolerance. Some people sit in the chair like, oh, that's it? No big deal. But we've spent more time so far talking than this actual treatment's going to take. So what we're going to do, we're going to actually go ahead and lay down.
Okay.
We're going to use this Zimmer Cryo Chiller, really, really fancy word for cold air. We're going to use this cold air to numb the area. I like to use the cold air instead of any kind of numbing ingredients because we want your body to worry about breaking down that ink, not worried about breaking down lidocaine or anything that we put on your body. So it's going to be a little bit loud in here. Go ahead and get you started. So if you can, zoom in here. Again, this is the second treatment. Should give you a towel. If you zoom in, you can already see where she's got broken skin. You want to get in there? So it's black ink, but it's got a little bit of an undertone of blue. And you can see where we've already moved a lot of ink just in that one treatment alone. So what we're going to do is get her nice and cold. While we're doing that in tandem, I'm going to go ahead and get the laser set up. And what we always do too when you're laying here, this is the first time, let's assume it's the first time you've been here, you're anxious, you're worried, you don't know what it's going to feel like. Yeah. We're going to get you nice and cold. And then I'm going to count down 1, 2, 3. And I'll do a couple little test spots. And that way you as a client would be able to get to feel how it feels. And most people say, oh, that's it? And I say, yeah. Then we get going. You can always stop at any point, so no big deal there.
Always remember to breathe. Breathing
yes,
is key.
So I'm going to go ahead and get this laser ready. Tell me if you're getting cold.
Definitely getting there.
Now, Stephanie is behind the scenes right now doing the videotaping. She's our massage therapist. She does do lymphatic massages, which you can always treat yourself after laser removal to lymphatic massages to help that system move that broken ink. Is there anything you want to add on lymphatic by chance?
It's very helpful in tattoo removal. It's a very, very relaxing massage.
And it's different than your normal.
Yes. I don't even really like to call it a massage because it's so different, but it is extremely relaxing.
So you're good cold?
Yep.
Perfect. All right, everybody's got their goggles on. I'm going to go ahead and engage the laser. All right. I also like to talk through so people know where we're at with the laser. So what I'm going to do, I'm going to start with this A right here where it's the darkest. Are you able to zoom in? Are you good? I'll just do a couple little test spots. 1, 2, 3. You able to see that frost? Perfect. All right, we'll get going. 1, 2, 3. Now, Brittany, tell them how you're feeling right now.
So it honestly just kind of feels like little tiny snaps, like a rubber band kind of, but because it's going so fast, it's more of like an annoyance pain. Like, are we there yet? Are we done yet? So it's definitely something that anyone could sit through.
Sorry.
You're fine.
So as Brittany was talking just now, we finished up the word have. You're getting a light frosting here. That frosting is that ink shattering. When we first did this first treatment 6 weeks ago, it was a bigger frost. The frost gets lighter and lighter the more treatments that you have, just because the ink is getting less and less dense. Frosting lasts about 10 or 15 minutes, and then typically fades away. I always tell folks too that sometimes the ink looks darker before it looks lighter, but you just want to let the body do its work. The body knows what to do. So as this laser is shattering this ink, your lymphatic system will start to, in the style of Pac-Man, start grabbing these smaller particles. I got the T and the H to finish it out. It's a little bit more sensitive here for her. All right, honey, we're almost done. Perfect. So that was your second treatment, 235 shot count. Is anybody asking questions or anything? Have you seen it? Okay. All right. So what we'll do now is we'll apply an aftercare on her. We'll tell her to keep this tattoo dry today. No saunas, hot tubs, and pools for 48, 72 hours. Keep it out of sun. Sun and laser are not friends, so always keep it protected. Drink tons of water to help the lymphatic system. And then we'll reschedule her for 6 more weeks, and we'll do another treatment. All right. Thanks, everybody. Call us with any questions. And thanks for watching. Bye-bye.